Hello, my name is Dr. Aditya Kapoor. I am a senior consultant orthopedic surgeon and the director of orthopedics at Omega Hospitals, Gachibowli. A question that I'm often asked over the past few months, especially after the multiple waves of COVID and with people being homebound, either working from home or the elderly who've been homebound, is about joint pain post-COVID. So we will divide this into a few scenarios. One of the commonest causes of bone pain and body pain over the last few years has been because people have been homebound and they haven't been exposed to sunlight, and low vitamin D is a common cause of body pain and stiffness. Vitamin D is also extremely important to maintain your bone strength, the integrity of your cartilage, as well as to maintain your muscles. So, vitamin D, how do you supplement this? A lot of times we've seen that people say that we get adequate sunlight. It's important that you get adequate sunlight, but this sunlight must actually touch your skin. The ideal time to get the sunlight is between about 6:30 and about 8:30 a.m. in the morning. The sunlight should touch your exposed surfaces like the skin up to your arms or your legs. The sunlight should also not be coming to you through glass. If the sunlight is filtered through glass, then a lot of the beneficial rays sometimes get filtered out. So, about 20 to 30 minutes of direct sunlight to the exposed surfaces in the morning is ideal. You can also supplement vitamin D through oral supplementation, which is in the form of either tablets or capsules. If it is extremely low, then we tend to give a few tablets or capsules continuously every day, followed by weekly and monthly supplementation. If the vitamin D is not that low, then either weekly or monthly supplementation is adequate. It's also important to remember that if you're taking the vitamin D, then it must be activated through sunlight. So a combination of sunlight and vitamin D supplementation is good. The other cause where a lot of people are coming forward with joint pain or body pain has also been because of inactivity leading to weight gain. Should you have weight gain, then what happens is that you're loading your joints abnormally. Remember, if you gain weight by about 1 kilo, then it's 4 times more force on your knee. Equally, through weight gain, what happens is that inflammatory markers called leptins accumulate in your body, and these lead to more joint pain. Significantly, if you have also been consuming excess alcohol or been eating a lot of non-vegetarian products, it could be increasing the uric acid level in your body, which could lead to joint pain, which is why a blood test to detect the uric acid is important. Another common cause is that when you are inactive, especially amongst the elderly, this has led to acceleration of arthritis and joint pain because the muscles around the knee become weak. Equally, if you haven't been loading your joints normally, then the cartilage becomes weaker. So a lot of the people, especially the elderly that we see, a lot of them are coming to us and telling us that we tend to have a lot of joint pain, especially in the last few years. To these people, our first bit of advice is that strengthen the muscles around your joints, take adequate vitamin D, take some oral supplements to supplement your cartilage, as well as maintain a healthy weight. Sometimes these people can also benefit with a small injection into the knee, a simple injection called as hyaluronic acid, which we commonly call as viscous supplementation. A lot of people are also coming up, especially younger people. COVID itself has led to what is called as an increase in avascular necrosis of the hip. Why this has happened is because COVID itself leads to a clotting mechanism, and these thrombi block the small blood vessels around the hip. Equally, to save people's lives, sometimes they were given steroids, and steroids can shut down the bone cells through a process called as apoptosis or cell death. So, a lot of youngsters come to us and with hip pain or with groin pain, sometimes with back pain, and the MRI has shown us that they have avascular necrosis, what is now being called as a COVID hip. How do we treat these people? Well, to these people, we would like to identify them early because in advanced stages when the joint has broken down, a hip replacement may be the only solution. And ideally, we would like to see younger people saving their hip. So when we see the younger people, how is it that we would like to treat them? Well, we would like to see them early, get appropriate imaging, and then initiate. The first thing we do when we see people with avascular necrosis of the hip is to give them a tablet called as bisphosphonates, along with folic acid, anti-cholesterol measures. It has been shown reliably and through multiple studies that a combination of bisphosphonates and folic acid actually retards the progression of this avascular necrosis. Equally, we have found significant success in the early stages and even up to stage 3 of the hip with avascular necrosis in implanting cultured osteoblasts after removing the dead bone through a process called as co-decompression and forage. And people up to stage 3 are also, we are managing to save their hips and restore their mobility. These are some of the common issues with regards to joint planes after COVID. Thank you.